This is your sacroiliac joint. This is where the ilium meets the sacrum. And every step you take moves the sacroiliac joint. It is your body's main shock absorber. It protects your spine from the shock of every step you take. You're feeling for a sacroiliac joint, you're feeling these bulges on the bone called the posterior superior iliac spines. When one of them is higher than the other, it means that the bone has tilted forward. If the painful one is lower than the other, it means the bone is tilted backwards. Here's your patient. He's standing with his legs pushing up on his iliac bones and his pelvis tilted forward. This allows you to feel his PSISs much more easily. Now, I want to feel exactly where these PSISs are starting because I want to know exactly in what position these iliac bones are. So I'm going to try and feel them. Now, I don't want to feel them with the flats of my thumbs because if I use the flats of my thumbs, they just glide on the back of the PSISs, and there's no way I can tell exactly where the PSIS starts. But if I use the sides of my thumbs and I put them like this and I advance them, when they reach the PSISs, they come to a dead stop and then they flip up. So I know where the PSISs are exactly when my thumbs come to a dead stop. It's at that point that I put a fingernail mark on either side. And then, once I've got the fingernail mark, I'm going to use a marker and I will mark exactly where the PSISs are. This is the perfect position to examine somebody's sacroiliac joint. The legs are vertical, the body is horizontal. And that way you can see how the ilium is bent forward and how the thighs are pushing up on the ilium. So when you come to examine this patient, you have to put your thumbs along the iliac crest and you follow them down until you feel where your thumb is going to hit on the PSIS, right here. And then you take a skin marker and you mark it. Okay, and again here, you use your thumb and you feel along the PSIS. Can you tell me where you're tender? Is that tender here? Show me exactly. It's higher up. So you're tender here. Okay, but your PSIS that I'm looking for. Oh, wait a second. Wait, here it is.
Yes. There.
Here it is. That's where she's tender. So we put a marker here, and now we can see that the levels of the two PSISs are very different. I wonder if you can stand up. Just stand up. And now I'm going to use a level, and I'm going to mark the exact spot, the exact level of her PSIS. So the lowest one is on the left and the highest one is on the right. And I'm going to mark the difference between the two levels. Now I'm going to take a ruler and I'm going to see what distance there is between the PSISs. And it turns out that there are 2.5 centimeters between the lower one and the higher one. So I put a B here for before and a B here for before. Which side is sore, by the way? Which is hurting?
Left.
Just the left. Okay. So we know that her left PSIS is very much tilted backwards, posteriorly. And so what we need to do now is we need to stretch the anterior part of her left thigh to pull on the ilium to bring this innominate bone anteriorly. So can you pull up your pants, please? Okay. Now, because her left ilium was tilted backwards, she is going to use her left thigh to pull on the left ilium by stretching her left thigh as much as she can. And she will hold this stretch as hard and as much as she can for the next 2 minutes. Find out whether these 2 minutes of exercise have actually helped anything. And remember that this is where the posterior superior iliac spine was before. It is. It's not here anymore. That's good. But where? Oh, wait a second. Here it is. Okay. Her left posterior superior iliac spine is here. This is before with the letter B, and this here is after with the letter A. Now let's see where the right one is. Oh, it's perfect. It stayed exactly where it was. Okay, so now let's check the level. Can you make yourself upright, please? And let's see if the level. Now this is after, and this is perfect. Perfect. Okay, that's it. She's corrected her back. Still have pain in your back?
No, it's gone.
Even when I touched it?
Even when you touched it.
Good. Right here. Now let's see where the left PSIS is. And this is not a PSIS, by the way, this is a mouse. That's what's sore? Right here?
Yeah.
Okay. Oh, okay. B here for before. And then we will use the level. Stand up.
Stand up straight.
Yes. Stand up nice and straight. And we'll see
together.
Yeah. And we'll see with the level. Okay. So can I have a marker, please? And we'll have a marker here. And now let's measure what the distance is between the PSISs. So there's 1.5 centimeter distance between this one and this one. And this one is 1.5 centimeters higher than this one. Okay. So what you need to do is you need to bend your knee until it touches the chair and put your foot on the middle of the chair. And now lean back, lean back. Feel how your thigh goes up against this bone here when you're leaning back, and now pull up as hard as you can. As hard as you can. Just keep pulling, because what you're trying to do is you're driving this thigh into your pelvis, okay? And drive it as hard as you can, because you want to force this bone backwards. You see, if you force the bone backwards, then you'll be able to put it back where it belongs, okay? So, and now you need to hold it for 2 solid minutes. That's the mouse. But Is this still hurting? Because this is where she's at now. That hurts now, but look, this is where she's at now. Let's see if she's level. Let's see if she's level. There she is. She's level. She's fixed her own back. Is I'm going to stretch this thigh because what's happened is your pelvis has gone back like this. So I'm going to pull on your thigh to bring it forward, okay? Now this one has gone forward. So I'm going to push your thigh against your bone here to push it backwards, okay? What I'm doing is I'm putting your pelvis back where it belongs, okay? On the very edge, and okay, that's it. And now bring your leg up like this, and now lie back, lie back, lie back, lie back. Okay, that's it. Now I'm going to put your foot on my chest here, on my sternum, and then I'm going to lean forward hard to push this bone again. You see, I'm pushing your thigh against your ASIS, okay? Very hard on this bone here to pull that ilium to the front, okay? And I'm pushing very hard on this one to push that thigh against your ASIS. And we're going to hold this for 2 solid minutes.
Okay, hands up.
Okay, that's it. 4. This is a B, and this is a B. This is where she was before, and there was 2 centimeters between these. So now let's see if she has changed, okay? So let's see, is she still, no, she isn't. Ah, here she is, right here. Okay, so the left one is here. And this is A, that's after. Now where is the right one? Ah, the right one is here. And so this is after. And now let's see if she's level. Can you stand up, please? And let's see if she is level. Well, she is perfectly level. Okay.
Nice.
Now she's level. Okay, good.
Definitely better. Definitely feels, I don't know, I guess more even in some way. It's weird. I haven't felt it so long, I don't know how to explain it.
Okay.
Oddly enough, I have noticed too that it's a little bit easier for me to keep my shoulders up, which normally is a very difficult position for me. I always want to veer down.
Yeah. First of all, do this. And that allows you to watch. I'm going to put it here and around your body. And where are the 2 little bones that were sticking out? They're right here. You can feel the 2 little bones that stick out right here. Okay? Put your fingers on the 2 sticky outy bones, okay? Because this is where you want to put the belt, just below the sticky outy bones, okay? The thing is that you want to hold this part of your pelvis in place. You do not want to open up those joints. If you put your belt here, you're opening up the joints. That would be totally counterproductive because then the joints can really go out. What you want is you want to make sure that those joints are well held together. So your belt is going to go right here, like so, and like so. Now, get the two little bows and pull on them really hard. So, yeah, put it as far forward as you can. That's good. That's it. There.
So that you hold it.
Yeah, that's it. Now, do something that would hurt your back. Is it hurting now?
No.
That's the name of the game. You can bend over as much as you want because your pelvis is being held in place.
When I get up, I feel the most pain, but this time I did not feel any pain.